Hi friends, good evening. I'm Dr. Ashutosh Gupta, and today let us talk about a celiac disease. Okay, so the global prevalence of the celiac disease, even though in India, is also 1%. So meaning thereby that it is not that uncommon. पहला, दूसरा, the diagnosis, the correct diagnosis of the celiac disease, probably in the pregnancy or in a pre-pregnant state, is only 5%. So which is around the tip of the iceberg. So many meaning thereby that many of these celiac diseases are being misdiagnosed, misinterpreted, and therefore they are not being diagnosed appropriately. Okay. Now, why I want to talk about the celiac disease is this? Then this is something that probably if we probably have an eye for it, then probably we can prevent a lot of complications to the fetus, right? So of late we are coming across with a few cases, in fact, in which we've identified that classically it is fitting into a celiac disease. So sort of an uteroplacental insufficiency. Then we started with some low molecular weight heparin or equaspirin, and then we are showing up some growth and all those stuff. Then it is dwindling at 28 weeks, and then we are doing something to the mother, and therefore we are increasing the dose of the clexane, and therefore we are not getting the appropriate response by those medications, and therefore we have to think out of the box that probably it is not classical uteroplacental insufficiency and something else which is not allowing the baby to grow further up. So the basic premise is a chronic inflammation which is going on into the mother's system, which is actually pro-inflammatory, pro-cytokines, and therefore leading to endothelial dysfunction or a uteroplacental insufficiency, and therefore that clinical picture gets into the celiac disease, right? So let us talk about a brief about celiac disease. Celiac disease is an absolutely preventable. It is an autoimmune enteropathy. पहला, दूसरा, it would be more common in North India because then we are fond of wheat, and so wheat, and then there's some wheat strains, and there are some people those who are genetically susceptible. Once they encounter the gluten in their diet chronically, therefore they do have those autoimmunity which would die down, or which would not be which would we would not have a flare for this autoimmunity or autoimmune enteropathy if we restrict or we strictly avoid this gluten through our diet. Okay, so meaning thereby that whatever we are talking about a uteroplacental insufficiency and growth and absolutely everything would get out of the window if we can diagnose it much more earlier, and then we do have a strict compliance as far as the gluten avoidance in the diet is concerned, right? So this autoimmunity thing and enteropathy leads to nutritional deficiency to the mother. So iron, folate, vitamin B12 leads to some sort of an anemia to the mother, which definitely doesn't recovers the mother definitely doesn't recovers from that anemia. Secondly, vitamin D and calcium malabsorption is there, and therefore it leads to some decreased bone mineralization to the fetus. Third, we can have some deficiency of the zinc and selenium, and therefore it might affect the neuro development of the fetus. And this transglutaminase the antibodies being produced in the mother's body passes through the mother's body into the placenta, and therefore leads to some issues. The decreased placentation, so the placenta is not able to supply to the growing demands of the fetus. There is endothelial dysfunction, and therefore pro-inflammatory, and therefore we can have abnormal uterine arteries, we can have abnormal Dopplers, umbilical arteries, MCAs, and so on and so forth. And this chronic inflammation that goes on into the mother's body, and therefore that leads to suboptimal growth of the baby. So we are dealing with low birth weight, prematurity, small for gestational age, high risk for PIH and preeclampsia, so a lot of complications, and nutritional deficiency both for the mother and the fetus. And this could be absolutely avoided if we can identify, if we can really pinpoint, if we can identify those susceptible individuals, and then do one simple blood test, which is a transglutaminase IgA antibodies in their blood, and then we can identify, and 6 months pre, so इसको ध्यान से देखिए. तो it is an autoimmune enteropathy. ठीक है, and then we can have this nutritional malabsorption, we can have a placental dysfunction, we can have these Doppler changes very early. But we identify कि 6 to 12 months pre pregnancy अगर gluten फ्री अगर हमारी मिल्यू है, so probably the absolutely the response would be like in the general background. So probably we can avoid absolutely the growth restriction, low birth weight, and SGA babies. So the response would be like the general background. So identification of this celiac disease, doing a simple. So this also tells us about that if we can avoid this gluten, the response is very fantastic, and it is very good. Right. So the only thing is this, that we need to do a simple blood test, transglutaminase IgA, and then we can identify. And but the genetic testing is absolutely not necessary, and we can do this duodenal biopsy so as to identify some villus changes and all those stuff. Right. But the take-home message is this, that identification of all these things pre-pregnancy is very important. Right. So as to avoid any complications to the fetus, as a matter of fact, and optimization of the outcome of the pregnancy. So one clinical suspicion, one blood test, transglutaminase IgA antibodies can lead to this diagnosis of celiac disease. And pre-pregnancy, if we can avoid this gluten through our diet, and we can do an optimization as far as the nutrition of the mother is concerned. So probably what we have identified is this, that strict this gluten is avoided into our diet. So the absolutely the nutritional status of the mother to the fetus, uteropleural insufficiency, prematurity, low birth weight, and taking the baby out very early, any leading to PIH or preeclampsia both for the mother and to the fetus, goes back again to the general background risk. So we are definitely in a position to avoid all these things across, just by identifying that probably somebody is having a celiac disease. So this is something too much to be asked for, but only thing is this, that probably a more sort of an surveillance is required, and therefore, so very of late we have had these two cases in which the clinical suspicion was with celiac disease during the pregnancy. So at 34 weeks, what we identified, that the baby is not growing, as a matter of fact. So probably whatever we wanted to do, we have done it, and therefore it is not exclusively the case of a uteroplacental insufficiency. This would be something chronic inflammation going on, and could be a systemic disease that is there in the mother, and therefore that is not helping, and therefore the uterus is not, or an endothelial dysfunction, and therefore that is not helping the baby to grow. So 3 weeks lag is there, and there is a failure to thrive, or the failure to growth to the baby is there. And celiac disease could be one of the sort of an commonest sort of an inflammatory bowel disease or an enteropathy that we can encounter. Right. Thank you very much for your patient listening.